So here's the thing. Gabapentin was never meant to be a pain medication. Never. Gabapentin is synthetic. It was meant to be a analog or an imitation of gamma-aminobutyric acid, which is a naturally occurring brain chemical that decreases the excitability of nervous tissue, of the brain tissue. It was synthesized in 1883. And what it does is it decreases the excitability of nerves. Okay, so what it was used for, and it's still used for, is for seizure disorder. Not the sole treatment for seizure disorders anymore, but back when I started, Neurontin was a key player in preventing seizures. So it is a seizure medication. Back in the 1960s and 70s, it was hailed as sort of what would be called a superdrug now. What we now call it a superdrug, in order to improve mental status and so on and so forth, a role for which it is not good. But because it was touted and it does stabilize nerve tissue, it, again, uses a seizure medication. But by extension of that, people use it for restless leg syndrome, because that's supposed to be to stabilize the nerves in the legs. And also it's supposed to be used for pain of a neurologic type. Now there's different kinds of pains. There's somatic pain, there's sharp pain, there's all kinds of different kinds of pain. But nerve pain is special. And nerve pain, if you've ever had it, you know what it feels like. A quick example of nerve pain is when you hit your funny bone. That kind of electric shock kind of pain, that's nerve pain. And if you've ever had any kind of an injury that causes damage to the nerves, you feel it, like sciatica. It shoots down from your back all the way down to your bottom of your foot. That's nerve pain. And the theory goes that if you stabilize nervous tissue, stabilize brain tissue, nerve tissue, it prevents nerves from carrying the impulses quickly. And by extension, it prevents pain or decreases pain. Yeah. The theory's good. The theory's good. And I use it in some patients as well. But it can't be used by itself because it is not a pain medication. It has all the bad parts of a pain medication, which is it makes you lethargic, it makes you sleepy, it makes you confused, but it doesn't have any of the good parts of a pain medication in that it takes care of pain. And why should it? It's not a pain medication. So gabapentin at best is an adjunctive medication to be used for nerve pain only. Again, nerve pain only, along with other pain medications. What I usually use it with is, let's say I have somebody that I started on a short acting. The short acting is not enough. I put somebody on a long acting with short acting for breakthrough, which is what I like to do. And they're having some breakthrough neurologic pain, or they have pain that keeps them awake at night when they're trying to sleep. So what I would do is I would put Neurontin at night to help them sleep, and it helps nerve pain. So again, it is useful in the correct setting, but if you think this is going to be the magic bullet to get rid of pain, it's not. It's a tool. It's a tool that you use to build your house and you build your pain medication regimen in order to get rid of the pain. You do not slam people with lots of Neurontin in order to get rid of pain because you don't want to use other medications. This is in addition to, not instead of.